Well, the blame game over Friday's healthcare fiasco still in full swing. But in a new op-ed, former New York City Mayor Michael Bloomberg perhaps said it best, saying, quote, "Who's to blame for the failure of the Republican bill to repeal and replace Obamacare? Who cares? What matters now is that Democrats stop gloating, Republicans stop sulking, and each party come to the table to improve a healthcare system that both parties agree needs work." Well, that sounds great. But is that even possible in D.C.'s heavily divided atmosphere? Peter Suderman joins me. He's a features editor at Reason Magazine and the nation's foremost expert on healthcare, specifically Obamacare. Welcome back, Peter Suderman.
Glad to be here. Thanks for having me.
So, Peter, my first question is, what went wrong?
Just about everything is one answer. The Republicans basically spent 7 years campaigning against Obamacare and promising to replace the law, but they never built any consensus around the replacement. And then they didn't really spend very much time trying to build consensus around the law once they had it in place. Then you also had the problem that President Trump really just didn't understand the details on this, and he really never made a case for the law on its policy merits. If you think about what President Trump and even also what Speaker Ryan were saying about this, they were saying, well, you got to vote for it because you'll lose your seat if you don't, or you got to vote for it because we need it to do tax reform. They never made the case that you need to vote for this law because it is a good policy. And that was what was really lacking here, was they just couldn't convince anybody that this bill would be good policy. And so the House Freedom Caucus looked at it, said, this is a hot mess. We're not going to play this game.
Yeah, and the emotional path from Obamacare is littered with the bodies of Democrats who acted too hastily, voted for something bad simply because their party said, get in line. And, you know, I argue that it was not necessarily the details, it was the structural aspect of the legislation that provided the fatal flaws. You know, you couldn't just tweak a few things and make members of the Freedom Caucus happy. It was structurally unsound, and that's why a lot of these people were opposed to it.
This bill wanted to kind of embrace a lot of the core structural elements of Obamacare, but without the stuff that held Obamacare together, or sort of did. And so what you ended up with was a kind of zombie Obamacare, right? It was like Obamacare, but with no life in it. It was gonna, it was gonna melt down as quickly as next year. The CBO said that 14 million people would, fewer people would have health insurance next year under the Republican bill. There were last-minute revisions that no one really even read, that experts were looking at, saying this is going to cause every insurer in the country to pull out of the individual market next year. That's how badly this thing was put together. And this is really a long-standing failure of Republicans to focus on both the structural elements and the details of health policy, and try to actually bring people together around an alternative. And that is not something that they did in this case, and it is not something that they have done for the last 7 years since Obamacare has been in place.
And, you know, I disagree that they were doing nothing over the last 7 years, but they certainly weren't building a consensus, like you said. So I guess the most important question is, because, you know, there are a lot of people who are worried about the state of their health care in this country, where do they go from here?
Well, I think right now where we go is the status quo. And so what we're going to see is that Obamacare is kind of shaky. Its foundations it doesn't work really well for a lot of people. We see insurers pulling out of the market. And so the big debate that we're going to see next is about whether the administration should prop up Obamacare, as the Obama administration did through some really kind of dubiously legal measures, stuff that, like, the Republicans were suing the Obamacare suing the Obama administration over. And so we're going to see some pretty serious debates about whether the administration should continue doing that sort of thing in order to try and stitch Obamacare together, or whether they should start on a new process, look for a different way to go about repealing the law and putting something totally different in place. Yeah,
it's going to be complex, but it is absolutely necessary to scrap this entire thing. There's no way you can do a superficial overhaul and expect the healthcare industry to continue working. Peter Suderman, thank you so much.
Thanks for having me.